Sarah M. Halter is the executive director of the Indiana Medical History Museum. She earned a BA in anthropology in 2005 and an MA in museum studies in 2008, both at IUPUI. She's a 2017 graduate of the Seminar for Historical Administration, now History Leadership Institute, and completed a certificate in fundraising management from the IU Lilly Family School of Philanthropy in 2018. She is vice president of the League of Women Voters of Indianapolis and secretary of the Southern Association for the History of Medicine and Science. She also serves on the advisory boards of the Easter Seals Crossroads of Central Indiana and the Center for Ray Bradbury Studies of IUPUI, the John Shaw Billings History of Medicine Society at IU School of Medicine, the Association of Indiana Museums, and Youth Enhancement and Training Initiatives. Take it away, Sarah.
Thank you. Can you guys all confirm that you hear me this time? Does that mean you can't hear me? Norma?
Yes.
Okay, you can hear me.
I'm so sorry. Yes.
Okay, I was like, someone tell me they can hear me because
I am so sorry.
All this time. All right, thank you.
I was looking for my mouse. Here,
been a weird day, so.
You are.
All right, so what I have to share with you guys today is not really a gadget or a gizmo, but rather a book full of gadgets and gizmos. It's one of my favorite books, of the books that we use regularly, in the course of our work at the museum. And since I have a lot to share with you, I'm also going to deviate from the norm a little bit by only talking about this one object rather than talking for a few minutes about two different things. So what I have for you is the 1908, maybe. I do have it. The 1908 catalog for the William H. Armstrong Company, which was located here in Indianapolis. It's really the 1901 catalog, but with an added insert with updates for 1908. But what's cool about this particular one is that it still has several order forms that are sort of held within the pages, which I think is kind of interesting. So here is the front of that insert, the new surgical instruments that were added, and you can see the form as well. So I'm going to talk a little bit about the surgical instrument industry in the U.S. and how companies like W.H. Armstrong came to be. And then I have some images from the catalog that are some of my favorite gadgets and gizmos in illustrated form that I want to see if you guys can guess their purpose. So let's get started. So this is W.H. Armstrong Company. You can see at the bottom it says established in 1885. I'm not sure where it was located at that time or under what name it operated, but it wasn't until 1889 that the actual William H. Armstrong moved to Indianapolis, and at that point he became the president of the company. So I don't know whether it was purchased and renamed or what the deal is with that, but all of their catalogs and a couple of other sources that we have say that it was established in 1885. These are later sources though, and there's really nothing from 1885 that suggests that it existed. So they continued through the first decades of the 20th century. They had a storefront, they sold through a catalog, they imported instruments, but they also made their own instruments. So they had a workshop factory on the site, and their workmen were actually paid for their time, not by the number of pieces that they produced. And that was one of the ways that they tried to ensure quality of the instruments. So in 1938, they went bankrupt and closed, and their remaining inventory was sold off by Sears, Roebuck and Company in kind of mid-July of that year, and you can see the advertisement for that. The other advertisement you see here is really not relevant at all to my presentation. I found it the other day, and I couldn't resist putting it in there. I just didn't want you to leave the meeting room today without having seen that. So please enjoy and keep it in mind for Christmas. So by the time the W.H. Armstrong Company enters the scene in the late 19th century, the surgical instrument industry in the U.S. was pretty well established. But going back 100 years, the medical profession in the American colonies had really relied heavily on Europe, as they did for so many things, and especially England, to supply their needs. This was true just kind of generally for anything that couldn't be produced in the colonies. It had to be imported. But the surgical field was very different at the time. And the surgical instrument industry was kind of a whole different game as well. So the earliest instruments in the colonies were brought here by immigrant doctors or as property of the companies that financed the colonial development. And though some instruments were handed down or purchased at estate sales, the vast majority of surgical instruments sold in the colonies were imported. And as the colonies became more established, surgical instruments were imported more and more frequently, and they were sold at shops and apothecaries that looked very much like this one. This is 1806. It says 1807 because that's the American edition, but it was originally published in 1806. But they looked pretty much the same, and they were frequently owned and managed by physicians. They often just had the basics available, so scalpels, scissors, lancets, probes, tooth keys. Some of the larger shops in bigger cities along the coast were able to offer more variety, so they might have things like amputating kits, pessaries and midwifery tools, cups and pumps for bloodletting and for cupping. But surgical instruments weren't very specialized yet at this time. This is from the tail end of the 18th century through almost the first half of the 19th century. This is a time when surgeries weren't very common, except for very minor procedures like draining an abscess or bleeding a patient, tooth extractions, or other kinds of very superficial kinds of procedures where they weren't very invasive. Amputations were also done when they were needed, though. But surgeries generally were difficult and dangerous, so unless the patient's life was at stake, those more complicated procedures just weren't worth the risk. There was no anesthesia at the time, and the pain and physical exhaustion that the patients experienced during and after surgery could severely weaken them and make it more difficult for their bodies to heal. This also made the surgeon's job more difficult. Imagine operating on a patient who's awake and alert and terrified and kind of in intense pain, and they're moving around and maybe even fighting you. So it was kind of a traumatic experience for everyone involved. Here are a couple of depictions of these early surgical procedures at this time. You can see how kind of scary and painful they must have been. On the left, you see a surgeon barber who's extracting a man's tooth, and on the opposite side, you have a surgical space where there's a guy in the back who's being bled. How clearly you can see it. The guy in the front, I'm not exactly sure what they're doing to him. He's having some kind of procedure done on his back or shoulder. But it's kind of a scary and difficult process. And if the patient survived the surgery itself, they still may not survive the infections that frequently follow the surgery. So here are some examples. Because most surgeries were pretty basic, the instruments, as you can see, were pretty basic as well, especially here or on this side of the ocean. It was a little more advanced in Europe, but these were the kinds of instruments that surgeons tended to have access to and tended to use. Many of them here in the US weren't yet those kind of ornate, fragile instruments that we see in the late 19th century. They had very little demand for anything specialized. These were practical and sturdy, and they were multi-purpose. They were sometimes all metal, sometimes you have bone or wood handles. These are some scalpels, a couple of tenaculums, scissors, that sort of thing. One of the more notable exceptions to the general rule that these instruments tended to be very basic and multi-purpose was the whole range of instruments and devices that were available for bloodletting. So, this is a later image, but most of these hadn't really changed very much. So there were all manner of devices and techniques that doctors could employ to make you bleed more efficiently. cupping with heat or even with pumps. This was used for cupping as we kind of think of it, but it could also be used over an incision to make the blood flow more quickly. Lancets, spring lancets, that's the little one with the blade and the trigger. And then you also had scarificators, which would have anywhere from 5 to 12 or more blades within it, and it also has a trigger. So when you pull the trigger, all of those blades kind of shoot out. And then scalpels, which you saw on the last slide, could also be used. And of course, leeches. Sometimes even fancy imported leeches were sold in these apothecary shops. And this is all well before the germ theory of disease became widely accepted. And though we see at this time, it's kind of the beginning of a shift toward looking at specific tissues and organs to study diseases and anatomy. Most doctors at the time still had this belief to some degree in humoral medicine. So the idea that imbalances in the body's four humors were responsible for all disease. And so to bring those humors back into balance, doctors used bloodletting, blistering, purges, and emetics. And then during the Revolutionary War, the American Revolution, there was a shortage of surgical instruments, as there were shortages of virtually everything. And the demand for them was also growing too, as physicians and surgeons saw more and more injured soldiers. This is a 1980 cartoon by Wilbur Keith from his book, Revolutionary Medicine. I think it's adorable, but I also love that he wrote at the bottom, in the manner of an 18th century cartoon. So, there's this shortage. These instruments and medicines are needed. So to fill the void with the surgical instruments, cutlers stepped up. So cutlers in Philadelphia and other artisan centers began producing surgical instruments. This had also happened in England about a century before, and the surgical instrument industry there kind of grew out of this. The same thing happened in the US just a little bit later. And of course, making steak knives and scalpels are not exactly the same, but the same materials were used and a lot of the same techniques. So it kind of made sense for them to step up to fill that void. And then even after the war, beginning about 1785, there's a decline in imports that continued from that point on as the US began to develop its own surgical instrument industry. So surgery at this time was changing a lot. By about the 1840s, it's become more of a distinct trade, and the surgical instrument trade in the country is becoming more distinct as well. These kind of happen at the same time. So in cities like Boston, Philadelphia, and New York, you see more and more of these companies or artisans who are making their own instruments instead of importing them. Between the 1840s and the late 1880s, medicine and surgery were both changing pretty radically, and as a result, the instruments had to change as well. At this time, surgery is sort of finally coming into its own, in cities at least. It's no longer really associated with the kind of barber surgeon, and it's becoming a more respectable profession and a medical specialty unto itself. And surgeries became far more common with the advent of anesthesia and later antiseptic practices. The surgeons by this time are less reluctant to perform surgeries. Of course, before antisepsis caught on, before antibiotics, they weren't necessarily less dangerous. Infections and complications were still common after procedures, and in hospitals, infections were rampant and spread rapidly. That didn't change until after the germ theory became widely accepted, and then even more so with the availability of sulfa drugs beginning in the 1930s, and then with penicillin, which was the first true antibiotic. So there were still problems with surgeries, but surgeons were becoming more confident, they were more daring, and they showed more bravado than they had before, and the surgical instruments that they were using became more showy as well. So they became almost like prized possessions. They were a status symbol in some ways. They sometimes would be made with fine materials like ivory, ebony, mother of pearl, precious metals like gold and the like. They were sometimes very intricately carved. They could be purchased in sets like these with beautiful cloth-lined wooden cases. Here is a much less practical example. This is not from our collection. This is from the Surgeons Hall Museum's collection. I don't know whether the set was truly used or if it was just for show. Maybe it was presented to somebody as a gift, but the handles are pretty ornately carved. They're mother of pearl. And although it's gorgeous, I think it's also a little bit absurd. In the late 19th century, though, as more and more kinds of surgical techniques were being developed and more types of surgeries were performed, instruments were also becoming more specialized. Physicians sometimes created their own designs too, which I think is funny. When you look through these later catalogs, you find pages and pages of instruments that are pretty much the same with only slightly different design elements. And so, you know, you have so-and-so's forceps, and then, you know, this guy has to have his own forceps. Everybody and their brother had to have a pair of forceps that were named after them, and you see that in the catalogs later on. So the surgical instrument industry really exploded in response to this new demand. But then there was another sharp transition that came with the acceptance of the germ theory. So beginning in the late 1880s to about 1890, you start to see this other change. Aseptic practices were kind of becoming the norm. The new idea in surgery was not just to kill the agents that caused infections by washing hands and instruments and by thoroughly cleaning wounds with carbolic acid after a procedure, which are antiseptic practices. We now want to stop the introduction of these agents in the first place. So we want to create a surgical environment that's free of germs. And in order to do that, the instruments, the bandages, the sutures, the bedding, everything has to be sterile going in. And if your instruments are made of materials that can't be sanitized or fragile materials that can't withstand the sterilization process, then you can't kill the germs. So you can't prevent their introduction into wounds or incisions. So surgical instruments now had to be made with still sturdy metals, but metals that didn't rust easily, that could be sterilized, and that could still be made into these more specialized and very precise instruments that surgeons were now relying on. And then as a bonus, asepsis made more radical surgeries possible. So the variety of surgical instruments that were available continued to grow and grow. And that brings us back to the H Armstrong Company in Indy. So kind of circling back to where we started here, and this company kind of comes about at the beginning of this last transition that I talked about. And it's really evident throughout, you know, these catalogs from about, I think the earliest one we have in our collection is 1894, and then we have up through the 1908. So, you know, they talk about new techniques in sterilization. They talk about the need for different kinds of materials, and you can see that in the catalog. And then, of course, the catalogs themselves show kind of the explosion of new instruments that are available. So this is the only image I have of Captain William H. Armstrong. This is from his obituary. He died in 1914 of pneumonia. He was born in England in 1844, and he moved to the U.S. at the age of 3 with his parents. They settled in Illinois, and that's where in 1863 he enlisted as a private in Company K of the 83rd Illinois Volunteers. So during the war, he rose to captain, and then after the war, he moved to Kentucky, where he worked in real estate. He also worked as an assessor for the IRS, and then sometime about 1869, or maybe shortly after, he moved to Terre Haute, Indiana, where he opened his own druggist shop. From 1883 to 1885, he served as mayor of Terre Haute, and then, as I mentioned before, in 1889, he comes to Indianapolis to become the president of the H Armstrong Company. And the catalog is pretty large. This is just a couple of pages from that section that was inserted with the 1908 edition. Just a couple of decades before this one was published, some of the largest catalogs around were much smaller, maybe a dozen to a couple of dozen pages. Without the 1908 insert, this catalog has 800 pages, and the index alone is 24 pages long with this tiny print like you see on page 2 there. It had pretty much anything any kind of medical professional might need: instruments for every specialty, exam and diagnostic tools, lab equipment, office exam room furnishings, hospital and home health supplies, anatomical books, anatomical models, medicine kits, prosthetics, all of these things. It was very thorough. So I had a lot to choose from when I selected some of my favorites for you guys today. We're going to try the poll feature. I don't think any of you heard me say this earlier. But we'll pop up a poll for each one, and you have a couple of options to choose from if you want to participate. Make your selection quick, because we only have really a moment to vote, or I don't know what you call it, to guess, I suppose, for each one of these. So well, let's get started with that. So this is the first one. Let me open the poll here. Can you guys see that?
It's visible on my screen.
Well, that's a good start. So the first question is, what on earth is this? Is it a pair of uterine dressing forceps? Is it a tenaculum, or is it a pair of appendectory forceps? And if the poll isn't working, let me know, or maybe just none of you are interested and that's why nobody has voted. Is that the case? I can just tell you what it is too. Let me see what's going on in the chat.
Hey, Sarah.
Oh, good Lord. It's okay. Never mind. You know what? Let's just let's use the chat. You guys can say in the chat what you think. A, B, or C. Uterine dressing forceps, tenaculum, or a pair of appendectory forceps. I'm seeing a lot of B's and a lot of C's. Probably more C's. One tenaculum. We got one vote for tenaculum. Oh, two. Kyra, you already said. Okay, well, I'll just tell you, it's C. It's a pair of appendectory forceps, and it has a removable shield for cauterization. So you would use these, that are kind of like clamps, and then that shield, if you used it, would protect the tissue that you didn't want burned when you're cauterizing. So wait, apparently I can't change the slide and look at the chat at the same time. So Eastman's appendectory forceps, removable cautery shield, $650, which seems like a good deal to me. So here's the second one. The question is, what is happening to these men? Are they redirecting gaseous smells away from their person? Are they receiving targeted hot air treatments for rheumatic affection? Or are they receiving a diaphoretic treatment that induces sweating, quote, more quickly and better than medication? Norma, can you watch the chat?
Yes.
Okay.
Ooh, C's, B's, C's, B, 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 C, B, 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 B.
No one thinks this is about flatulence.
B.
Well, it sounds like everybody's right, because both B and C
Okay.
or C are technically correct. It could be either of those things. So this is a flexible medical hot air bath that can be used for both of those things and others. This was a pretty new design in the 1901 catalog, and it was flexible and thus adaptable for different body parts. It was fairly portable. And this is a quote: "When operating, the fuel, which is alcohol, can be replenished without disturbance or inconvenience to the patient, and there is no odor of any description or danger of burning," which is good news. But that's all theoretical too, because let's not forget how dangerous the safety X-ray machine in our collection actually was when it came out in the 1920s. So here's the third question. What specialized type of surgery are these instruments used for? Is it skin graft, cleft lip repair, removal of stubborn blackheads?
Ooh, B, B, A, B, 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 A, B, B, A, C, no, B, 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 A.
B, sounds like.
A lot of B's.
All right. Well, that's correct. These are all tools that were designed to be used during a cleft lip repair surgery, including the little head brace at the bottom, which I felt like I needed to cover because I thought that would give it away. Maybe not, though. Oh, gosh. Something went wrong here. I've got a slide missing. Well, we'll just, oh, they're out of order. Man, I'm on a roll today, aren't I? Well, you probably know this. What are these specula used to open? A, any fistula, B, the ear canal, or C, nostrils?
C, 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 A, C, 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 C.
C it is.
Yes.
So these are nasal specula. And if you think that looks uncomfortable, you should see some of the rectal specula we have in the collection. Some of them are even made of glass, which maybe that's okay. I'm not qualified to have an opinion about that, but it just seems it seems like a bad idea to me. So, all right. So what does this do? Does it A, fumigate a room or space with carbolic acid? B, sprays water inside the vagina to flush out any discharge or secretion? Or C, provides hours of backyard water fun on a hot summer day?
B, 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 A, B, 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 B.
Sounds like we mostly have a consensus here, and you're right. It's B. That was B, right? Yes. So this is a spiral spray fountain, which sounds a lot more fun than I imagine it was. But according to the catalog, it easily and comfortably inserted, and it had 30 spray jets to shoot 3 quarts of water per minute to rinse out any discharge or secretion, and promised to cause no shock and no injury to the patient, presumably. What is this one used for? And if the shape has you flummoxed, here's a hint. So is it A, stabilizing a broken limb, B, a saline drip, or C, dry cupping?
A.
Well, I stumped you guys this time. It's actually for dry cupping. So at the top of sort of the sleeve or the boot, there's kind of a rubber band-like seal that allows you to pump air into the boot or the sleeve, and it created pressure, which was supposed to help circulation. You know, it was recommended for paralysis and muscle atrophy, and it was supposed to be better than traditional cupping because it didn't produce sores or painful blisters. And then this is the last one. So what are these various specula used to hold open?
A, C, A, C, A, C, C, A.
I think I got you again. These are more nasal specula.
Yeah, no one said B yet.
Yeah, it's hard to imagine those in your nose, isn't it? And that's all I have. I'm gonna stop sharing my screen.